morning, everyone. Welcome to our quarterly stakeholder update webinar. We see folks are starting to join, so we will give it just a few more minutes so that people have an opportunity to join us. So hang in there for a few minutes and we'll get started. Thanks. Welcome, everyone. We're going to give it just a minute more just to make sure people have an opportunity to log into the webinar before we get started. Thanks. Okay, it looks like we have kind of plateaued in terms of people logging in, so maybe we will go ahead and get started. Welcome, everyone, to Oregon's University Operating Home Visiting Initiative Stakeholder Update webinar. This is brought to you, it sounds like a commercial a little bit, but it is brought to you by 4 of the partners that are involved in this initiative. Family Connects International in partnership with Duke University that have the Family Connects newborn nurse home visiting model that we're using. The Division of Consumer and Business Services, they are partners as we work with the Commercial Health Benefit Plans. The Oregon Department of Education Early Learning Division, they are our partners in co-facilitating this webinar and helping us roll this out in complete partnership across the state. And the Oregon Health Authority, who has the statutory authority to implement a newborn nurse home visiting program for all Oregonians. My name is Kate Wilcox. I'm the Maternal and Child Health Manager at the Public Health Division of the Oregon Health Authority. And just as a point of housekeeping, we will be taking questions at the end. So keep your questions and type them in, and I will turn this over to Elizabeth.
Good morning, everyone. My name is Elizabeth Underwood. I'm with the Early Learning Division and Healthy Families Oregon, and co-chair of the steering committee. So here on this slide, I just want to acknowledge what Kate mentioned previously about the opportunity to type your questions into the chat box. and that we'll address those at the end of the presentation. So next slide. Yes, we want to keep you abreast of all the latest that's happening with the initiative, and obviously engage in the process as we move the work forward, and this is one way we can do that. I do want to begin with providing you with a brief background or refresher on the concept of universal home visiting and what that means. Next slide. So, universally offered home visiting is an initiative to strengthen families by offering a voluntary home visit by a nurse shortly after the birth of every child. The birth of a child is a big change for any family, and most families welcome and need support of some kind, whether that's getting an answer to a question about breastfeeding or getting connected to a local community resource. And of course, the why is that we know connecting all families, let's see, we're back on the last slide, thank you, in need to preventative services is the route to community level change and a cost-effective investment in long-term population health outcomes. Next slide. So the goals of universally offered home visiting to create and strengthen community-level systems of care for families of newborns, to offer support to all new parents in Oregon, regardless of risk and insurance status, to increase access to community services and support, to promote collaboration and coordination across Oregon's early childhood and home visiting systems, and to improve health outcomes for families across the life source. Next slide. I'm going to turn it over to Kate now. Looks like we're waiting to hear from Kate.
Oh, sorry, I was on mute, as always. Thank you, Elizabeth. Based on the Senate Bill 526, which is the statutory authority for us to do this work, there were criteria set out as to the type of model that could be used to implement this work in Oregon. And currently, the Family Connects model out of North Carolina is the one model that meets these criteria. This model has a lot of flexibility, which is really great, so that we can adapt it to our local communities and our Oregon-specific needs. However, there are a few requirements that lend to its evidence base. First of all, it must be offered to all families, regardless of income, risk factors, or background, and that typically happens in the hospital right after birth, but not always. But the idea is that it is a universally offered service. The next piece is that home visits for those that would like them, which is about 70 to 80% of families of the 100% that are offered. Those visits are scheduled about 3 weeks after the baby's birth, and usually after discharge. So it happens pretty quickly after families get home. The next component is that there is no cost to the recipient. So a family won't be charged for these services. And the last component is that it is required that it's a registered nurse that provides these visits. And the evidence shows that that is the most effective personnel or person to do this work. And part of it is that some of the work that happens in that first visit are nursing assessments that require that nursing training. So those are the key components of the model that we'll be implementing in Oregon. Next slide. So if you want to look a little bit more at where we've come and a little bit more in depth about the Family Connects model. We did talk about this at our July 2019 All Stakeholder Kickoff webinar, and there's the link for that. Also on our website, there are the recordings of all the webinars. We had one in July, and we had another one, I believe, in November, and now we're holding this one in April. Next slide, please. Okay, so now we're moving on to updates of where we are. We have been pretty busy, which is exciting. So let's start off with the next slide, and we can share that we have been doing some hiring at the state level so that we can have capacity to actually work with our communities and roll this out. So as of April 1st, we have completed our hiring. We have a full-time public health nurse consultant, a health plan integration specialist, a part-time research analyst, and a part-time administrative support. So up until this point, we've sort of been rolling this out with the capacity that we've had. So we're pretty excited to now have a full team. And that team, here they are. Bobby Bowman Meza is our public health nurse consultant. She has a background in home visiting with Multnomah County, and most recently has come to us from Kaiser. So she brings a lot of breadth and depth, both at the home visiting level, but also in working within the commercial health plan environment. LaShonda Friedrich comes to us most recently from our adolescent health unit. She's worked a lot with the school-based health centers and has a background in health finance. And she just joined us last week, so we are very excited to have her a part of the team. Even though we're all working remotely, we are doing our best to connect and bring LaShonda into our fold. Allison Mobley has a background in program evaluation and research and has worked at Johns Hopkins University and health communications, as well as having had her own consulting business, and has worked a lot on the family planning and reproductive health projects at the state. And Jessica Engelman is our administrative support. She has a lot of experience with transportation at the local level in Multnomah County and working on project management within the public works environment. So we're very excited to have her with us. So this is our team. Next slide. The Family Connects team also has gone through a couple of changes. In the past, Ashley Alvord had been working with us. They also had the opportunity to gain some capacity and support. So Deja Deva has joined us. She joined in November as the implementation specialist. And so she's been working a lot with our local communities, our early adopter communities, and helping them with their community alignment work. So we are thrilled to have Deja with us. She's brought a lot of energy and insight and expertise to the project. Next slide. Okay, Senate Bill 526. This was the bill that was passed in the 2019 legislative session. And what it did and does is provide the Oregon Health Authority the authority to develop and maintain a voluntary statewide program to provide universal newborn nurse home visiting services to all families. It also requires commercial health benefit plans to cover these services for their members without any cost sharing. We have been working hard to develop the administrative rules and that will outline the regulation, procedures, and standards for implementing the bill. Next slide. So the rulemaking process, we started that last September. We drew the Rules Advisory Committee from our steering committee primarily. We also added in some other people who brought different types of expertise to make sure that we had the right voices and expertise at the table as we were developing the rules. These are, this bill is the first in its country, and so we didn't really have a model of rules to go by. So it was really it was a good process, a very thoughtful process that we did over the course of 4 or 5 months. We met monthly from October through February and revised those rules. So we feel like we've got a good set of draft rules. We have the draft rules ready to post for public comment. We had them up for about 24 hours, and then due to the COVID-19 response, we were asked, and rightly so, to pause all rulemaking that's not directly related to the COVID-19. So as soon as we get the go-ahead, we will be posting those rules again for public comment for 30 days, and we will also have the public hearing, around which then after we will be finalizing and putting them into effect. Right now we don't have a timeline, but the work can still continue. The work has been continuing while we've been drafting the rules for the early adopter communities. So I feel confident that we can continue and that we will definitely have those rules in place sometime maybe in late summer, early fall. Next slide. The rules, some of you have been involved with them, but these are the types of sections that you will see when we are able to post the rules. We have a whole section around the community lead role, and that's the role that develops that system of care at the community level. They're the ones that are currently doing the community alignment work and connecting with all the partners so that we can have that solid referral system and connection and community, that system of care in place to support the work. There's also several sections around the home visiting service providers and the certification process and how that coordination and training will work. And then program compliance, and then the requirements for the health benefit plans. The health benefit plans also are regulated by rules and under the Division of Consumer and Business Services. So some of their work actually is covered under those other rules. So that's a preview of what you will see when the rules are posted. Okay, I will turn it over to Elizabeth.
Yes, this slide really gives you a snapshot of the work, where the work is happening, and how it's happening, where the work is happening, and who's doing it in the early adopter communities. So you'll notice that there are 3 early adopter communities with public health as a lead. That's Clatsop, Lane, and Washington. And there are also 5 early adopters where the Early Learning Hub is the lead. So that kind of gives you a sense of the different ways partnerships are happening in the different communities. This information kind of gives you a picture of the work that's happening. OHA and Family Connect International are working directly with the communities through regular site visits prior to COVID-19 and continuing through phone calls. Communities are in the planning stage, and service delivery start dates are currently anticipated to begin late 2020, early 2021. So this community alignment work really pinpoints the unique strengths and the needs of a community, and the purpose is really to help folks determine locally what their best path forward is towards service delivery. The identification and collaboration with partners is ongoing and continuing. And of course, each community is different, so their timelines for providing the home visits also vary. I would have to note here that the COVID-19 pandemic really is requiring the early adopter leads to work quite differently, pivoting so many resources towards supporting families in the areas of health or public awareness, childcare, parent education. At the same time, that work is resulting in some new and closer partnerships, some greater understanding of each other's work, and some creative thinking about services and tools that might be useful to carry forward into the work of setting up Family Connect visits in communities. Next slide.
Okay. So it's back to Kate again. to share a little bit more about the work we've been doing with the commercial health benefit plans. We've been working with our partners at the Division of Consumer and Business Services and the commercial health plans to identify how best to integrate this work into the health plans and the insurance coverage. So we've been looking at billing, what are some CPT codes? Are we going to do global payments? What are the service networks looking like? Identifying who is the covered beneficiary. Lots of conversation around this. Is it the mother? Is it the baby? Is it both? Because both have components within the model. We're working on what are some of the challenges we have. I went to public health school. I didn't really go into health finance as much, but I'm learning a lot about the different types of health plans that are out there and some of the stumbling blocks that we are experiencing that we're figuring out how to work through. For example, the high deductible health plans have a deductible before the insurance kicks in. So how do we provide services at no cost to families within that environment? Some plans that people have in the state are based in other states that are outside of Oregon and therefore are not subject to Senate Bill 526. So how do we support those families getting these services at no cost, as well as being able to support the providers and pay the providers for their services. The uninsured, we are fortunate in Oregon that our uninsured rate is quite low, but we still do have some who are uninsured. And then how do we work on the reporting requirements and the data interoperability? And so there's just never a dull moment in this arena of the project. We know that about half of our births are covered by Medicaid, and approximately another 25 are covered by health plans that are subject to Senate Bill 526. But we do have this 25% of self-funded plans outside of Oregon jurisdiction and uninsured. So we are working hard with our partners on figuring out how we can make this model work within that environment. Next slide. Some of the work that we've been doing so far is modeling what that billing structure looks like, working with our actuaries within OHA to provide a model so that the health plans can use that as they move into their rate setting process, which is happening at the moment. We were able to get that model to them in time by the end of February. We're also working on problem solving, a lot of the problems that I addressed in the prior slide, so that in partnership we can make this roll out. I will say I've been so impressed and grateful for the partnership that we have with the commercial health benefit plans. It is clear that everyone understands and believes in the value of this service for our families with newborns. And it's just that there are lots of ins and outs and the devil is always in the detail, but we're going to work through those and we're pretty excited about it. We will say that again, the COVID-19, our commercial health benefit plans have had to pivot to work on the response efforts. And so we just want to acknowledge that some of this work will be slowed or delayed, and we are all supportive of where the efforts need to go to the emergency response right now. Next slide. So to that end, just to acknowledge the impact that we are all working under and experiencing both in our work lives, our professional lives, our home lives. Those of us that are parents are learning how to monitor and be teachers and homeschool. And so that's a new responsibility for some of us. But we are seeing some delays and slows in terms of the community alignment work, as Elizabeth shared earlier. The lead agencies and the community partners, I mean, the hospitals in particular, are so focused on where they should be focused. And so we are seeing some pause in some of that community alignment work. Clearly, that means that then we will have a delay in when we are able to start the home visiting services. We've shared with our early adopter communities that aiming for January 2021 is just perfectly fine. Once we kind of come out of this and we can start convening the partner work at the local level, hopefully this summer. Then we can start planning on when we can train home visiting nurses for that work. The other part of this is that the commercial health plans, we were aiming for inclusion of their members in the coverage in January, so it all aligns nicely. But we are going to see some delays in setting up the billing and insurance systems because the commercial health benefit plans are also engaged in the emergency response. We've talked about the delays in finalizing the rules and the effective date of those. And then just more, I will say the only silver lining of this whole COVID pandemic is that it has allowed us for a little bit more planning and preparation time at the state and Family Connects model international level to be able to kind of get on more solid foundation as we move forward. We were sort of building the plane as we were flying it, and so this pause allows us a little bit more time to onboard our staff and get some of that planning under our belt. Next one. Another piece that's coming up that we are continuing to work forward in is the planning for the 21-23 legislative session. We knew that the work that came out of the 19-21 session was sort of a down payment, if you will, on implementing the program, the initiative, and so now we are preparing our policy option package for consideration within OHA leadership and beyond for the 21-23 legislative session. And I will say we know a lot more now than we did 2 years ago when we were planning it for the prior session. And we are, our communications work is really getting launched, and it's very exciting. We had a press release that really announced the launch of all this work, even though we've been working on it for quite some time. That went out in February, and we had a couple of radio and television interest in moving that forward. We have also launched our newsletter, which is the blue piece on the right of the screen. Our website has been updated, so we encourage everyone to go to the website. We have moved our entire stakeholder communications to a subscription model. We've moved everyone that we had on our stakeholder list into this subscription, so now it will be an opt-out. If you no longer want to be receiving regular updates from us, you can go onto the website and unsubscribe. We are encouraging partners as they are interested, and please share with anyone who might be interested to go to the website to subscribe to our communications, and then you will be part of regular updates, including getting our monthly newsletter, getting notifications about, for example, the rulemaking, the public comment period when that opens up, these quarterly webinars. We think it'll be a more efficient way of staying in touch with people. So please go and check those things out. Okay. So even though things have slowed down, they have not stopped by any means. We are working hard on these next steps. We are working with our Family Connects folks and their data at Salesforce to start working on what that data interoperability might look like, so that as soon as local hospital data systems folks are available, we can start working on that. We are starting to work on what the billing mechanisms might look like. We are still working on how do we work on the self-funded plans and the plans out of state in terms of assuring coverage for those infants, as well as the high deductible health plans. We are onboarding and orienting our new team. We continue to have monthly or weekly, every other week, calls with our early adopter communities just to stay in touch and provide support as they are able to be able to continue some of the work, some level of work. And we continue to obviously monitor and assess the implications of COVID-19. And then we will be letting everyone know when the pause lifts on being able to continue our rulemaking process so that we can put those out for public comment. And I think that is it. We are ready for questions. So if anyone has questions, please feel free to type them into the chat box and we will address them. I am not seeing any questions coming up. Is anyone else able to see questions? Anything in the chat
Hi,
box?
Kate, this is Jessica Engelman. I have some questions coming up in my question box that I can read out.
Great.
We have a question from Kristen Downey. She asks, will Medicaid members have access to this program?
Thank you for that question. Absolutely. The mechanism by which we are working with Medicaid is through a mechanism we have right now called targeted case management. It's a mechanism we use with our current nurse home visiting programs. That's probably the easiest of all the insurance coverage groups to manage. We are also starting to work with, we're going to be launching work with the CCOs and how we can roll this into their service, the benefits for their members. So absolutely, Medicaid is part of that universal group. Do you want to just read out the next question?
Yes, I have another one from Jennifer Baker. Is there any concern about nurses going into people's homes before we have a COVID-19 vaccine that is widely available?
Thank you, Jennifer. That's a really great question. You know, I think we're going to have to just see how things roll out with the pandemic and the continuation of the arc of the pandemic and what's going, how we're going to be working in people's homes and with people, not just us, but all sectors of life are going to be looking at this. Currently, our home visiting programs, both our nurse home visiting and Healthy Families Oregon and others, are doing a lot telephonically to be with families, to support them as best we can. But the hope is that we will be able to move forward with nurse home visiting in the homes, all home visiting back in the homes, because we know that that is the best setting to be able to provide these services. So I don't know the answer yet, but we will have to see what the recommendations are coming out of CDC and our own Oregon Health Authority from the medical experts.
This might already have been addressed. Kim LaCroix, will telemedicine visits be allowed?
I think we are doing that now, and I think we need to kind of see how our new normal looks and work with the model developers on how that can be integrated into the existing model.
From Jennifer Baker again, will OHA have all necessary funding for this program given the current pandemic and high entry of Oregonians into the Medicaid market?
That's a really good question. I think that is yet to be seen. The intent is still the same, that we want this service to be offered to all families, and Medicaid obviously is a big portion of that. I think we have some mechanisms by which we can have a state and federal partnership with Medicaid, knowing that that is a partnership in terms of the funding and the resourcing. But I think it's too early to tell how that's going to play out. And I think one of the things that we'll probably, we may experience is maybe just a delaying of how we roll this out across the state. Our current thought is that we were hoping and are still hoping to be able to roll this out over 6 years, of which we are coming up on the end of year 1. So I think we've got a lot of opportunity and lots of time to see how the pandemic really impacts our new normal and what that's going to look like from a fiscal perspective for everybody and for the state.
Next question is from Dana Hepper. Will we start offering visits virtually if needed? That is similar to the telemedicine.
Right. I think we need to have a conversation with the model developers, because obviously this isn't part of the evidence base, but I think we've got a little bit of time to see how the pandemic plays out and have that conversation. I think it's on the table, but I don't know that I have the answer today, but it's certainly within the conversations that we're having.
Next question from Rochelle Phillips. Is there any word on when the next application period will be?
I'm sorry, can you repeat that one again?
Is there any word on when the next application period will be?
Thank you. The next, when we're going to start working with the next cohort. Our plan is that we would, as of now, that we would go ahead and start to engage the application period in the fall. But we're going to, again, that's still tentative, not knowing what's going to happen with the play out of COVID-19. That's still our plan, though, to start engaging the next cohort in fall.
Next question from Deborah Riddick. Because site visits are calls, are there plans to follow up with visits post-COVID?
Oh, well, we haven't started actually providing any services yet. So I would say at this point, we need to continue to see how the pandemic rolls out. I'm sorry, I feel like I keep saying the same thing over again because it is still so uncertain what's going to happen. But since we haven't started providing services yet, and we have pushed that out until January, I think we'll have some time to see what our new normal will be.
Next question from Deborah Riddick. Is there a plan to work with OBGYNs and the CNMs to introduce the concept in last trimester to increase uptake? Yes,
I think that is part of the community alignment work that happens at the local level. And we are trying to, in terms of connecting with not only just the pediatricians and the OBs for the postpartum work, but also connecting with them prenatally so that we can get the word out, doing the outreach that this service will be offered right after you give birth. So this is a really interesting model, and this is why we're sort of the groundbreakers. We're the first state to roll this out across the entire state. So there are pieces of work that we can do at the state level that is cross-cutting to all communities. And so one of those will be using our mechanisms for connecting with providers across the state to let them know about this service as we roll it out. So I think we're looking both at the community level and at the state level how we can do outreach.
Next question from Corinne Potts. How does the pause due to COVID-19 affect the dates for the next rounds of adoption?
Yeah, we aren't quite sure yet, and this is a little bit what I answered the last time. We're still putting the idea out that in the fall, late fall maybe, that we would start to put out applications for the next cohort. We still want to keep that as long as we can, but again, we need to see what the trajectory of the pandemic is in Oregon.
From Deborah Riddick, do you believe the POP request will be impacted by anticipated budget deficits related to COVID efforts and tax revenue?
That has run across my mind in my early morning dozing moments when I'm thinking about all things that worry me, and that does worry me. What's greater is just what the economic situation will be for all Oregonians post, and once we kind of get through this really, really challenging economic time. But I do think that there will be some implications with this, yeah.
From Rochelle Phillips, if TCM is being considered as a payment option for Medicaid patients, what about payment for direct services such as breastfeeding support or weight checks?
Yeah, so there's some of them are TCM reimbursable, We do have general funds that we are giving to service providers that would cover the non-reimbursable portions of the visit.
We have a comment from Deborah Riddick. She says she appreciates the diversity on the team, which mirrors the sentiment in the roles.
Oh, thank you.
It's
a great team. I gotta tell you, we got an awesome team.
Next question, Elise Harley. Will the TCM match for Medicaid match come from local counties and hubs or from state general funds? Will counties have to use their pre-existing match funds to build TCM?
Great question. We intentionally built the budget so that the match would come from state general fund, not from local general fund. We've seen in our other programs that have used TCM where we're able to give some state general fund, but the local sites have to supplement that to make it whole from local sources. And that has caused disparities from different communities, some who have more availability of local funds and those who don't. And so our thinking was we want to eliminate that disparity so that all communities can provide these services. So the match will come from the state.
And we have one more comment from Jalen Suppa. She says, I think the Confederated Tribes of Warm Springs is trying to figure out how this fits in with what we are currently doing because we are already doing this work, but like to mention to keep tribes in mind as we move through this process.
Thank you, Jalen. Yes, absolutely. I think you'll see in the rules when they are published for public comment, when it comes to the community lead role, 3 entities have are eligible to be the community lead. It would be local public health, early learning hubs, and tribes. And I completely appreciate what you're saying. Warm Springs has been doing this work and is just a really great partner in the Central Oregon early adopter community. And we really appreciate your partnership and leadership in that work at that community.
And that looks like that's all we have for questions and comments at this time.
Okay. We might leave it open for just a few more if anyone else has questions that they'd like to type in. I just want to say that, I mean, clearly this was in the slides and was throughout all the answers to the questions. We just are in a pretty uncertain moment right now. It doesn't mean that we're going to stop our work by any means, but our work will be a little bit different, maybe delayed in terms of what our original plans were. We're going to need to reconsider some different ways of maybe doing our work in collaboration with all the partners. So we just really appreciate all the flexibility and patience with us as we navigate these sort of uncertain times. I'm confident and always the optimist that, you know, once we get through this a little bit farther and our world starts to open up again, and we are able to get out and about and our economy starts to rebound, that we'll be able to continue moving this initiative forward. In the meantime, we'll keep working as best we can within the context and the ever-changing context. So we just really appreciate all of your support as our stakeholders, and please be in touch with us as often as you want. And please subscribe if you aren't subscribed. Well, if you're on this, you probably subscribed, but please share the subscription with friends and whomever, partners, so that we can get the word out about this. Any other comments or chats, questions, Jessica?
Nope, that's it.
Okay. Well, on behalf of Elizabeth and myself, we thank you for coming and joining us And we will be in touch through other communications, and we will have another one of these webinars in another quarter. Take care, everyone, and be safe, stay home, and sing a song or two. Bye-bye.